right. Well, welcome to Revolutionary Health. Revolutionary Health is a program of the Counter Narrative Project, and the mission of the Counter Narrative Project is to build power among Black gay men and work in coalition and solidarity with all movements committed to social and racial justice. Thank you so much for tuning in tonight. So here's a couple of things that you can do. You can follow us on social media. On Instagram, we are at The Counter Narrative. On Facebook, you can find us at The Counter Narrative Project. And on Twitter, you can find us at Building Desire. You are joining us right here from YouTube, most likely. And what you should do is go ahead and click the like button. That's the little thumbs up button here on this video. Make sure you like the video as you are watching it. If you have questions, please go ahead into the chat box and leave any questions or comments that you have as we go through tonight's program. So my name is Johnnie Kornegay, and I am the Mobilization Director for Counter Narrative Project, and I am joined with...
My name's David Malebranche. I'm the token light-skinned person in this room right now.
I am Damian Denson, and I don't have a hilarious tag. Just here to support this light skin man.
I feel so oppressed and put off.
That's why we're not gonna get no Emmy now.
Thank you so much. So tonight's show is around erectile dysfunction. So please join us, like I said, in the comments. We will get to as many questions as we can as we go through tonight's discussion. So I wanted to open this really quick. So first of all, David, can you talk to us a bit about what erectile dysfunction is, what causes it, all of that stuff?
Okay, this is where I get to be doctory.
You get to be doctory.
So erectile dysfunction is kind of part of a continuum of sexual health disorders that men can have. You talk about premature ejaculation or other kind of sexual disorders. Erectile dysfunction is just considered one of them. And basically it's just you can't get hard, or the other term would be impotence. And you have to think about the physiology of erections in order to kind of understand what can go wrong and why people can't get hard, why guys can't get hard. And you think about it, it's kind of a complex system that goes on between the brain getting turned on, releasing hormones that go from the brain, stimulate the testicles to produce testosterone, and then also complex with nerves and blood vessels. So the signals go down through your nerves to open up your blood vessels in your dick, and then your dick gets hard. And basically when you get hard, it's just your dick is filling up with a lot of blood. So the blood vessels open up like that. And if you think about your dick, it's kind of like spongy material inside, and it's got small blood vessels. So it's like a sponge, and you know how a sponge can get engorged with water and kind of get larger. It's the same way with the tissue in the penis or the dick. You can just basically fill it up with blood, and that's how it gets hard. And then eventually you get to a point where you ejaculate, and then it goes back down. And that's, again, kind of complex with hormones, nerves, blood vessels, and everything kind of works in tandem like that. So if you think about, different things that could cause problems with it, so we say, well, what could cause problems with this erection problem? So if you think about the brain, you're going to think about whether you're depressed or you're anxious or you're under a lot of stress. And so sometimes that may kind of get in the way of you getting turned on from an emotional or kind of a brain perspective. And then you think about other things that affect the nerves or the blood vessels, things like high blood pressure, diabetes. If you have some spinal problems at the waist, it can produce problems with you going down there. So heart attacks, other kinds of things like that. Certain medications can cause problems with it depending on how they interact with your body. And so there's a lot of different things, but literally you're thinking about what comes in the way of your brain stimulating those hormones, what can block the nerves and the blood vessels from doing what they need to do, and then you can't get an erection like you want to.
Perfect.
Joel, John, and Walter say hello.
Hey, y'all.
Yes.
Hey.
Hey.
Can I ask a clarifying question?
Of course.
So when the term erectile dysfunction, or ED, does it include both the chronic condition, which I consider impotence, as well as episodic erection failures?
Yeah, so erectile dysfunction can be like a continuum.
Okay.
So it doesn't have to be that it's just for a long period of time and you've had it for years, and like an older person who is struggling because they have high blood pressure, diabetes, they've had heart attacks, and their blood flow and nerve conduction isn't as good. This can happen in someone who's like 21, 22 years old, under 30 and having a problem.
Okay.
It's just, and I think it's a good question because when I think about it, you always think about the norm. Like everyone's going to be different. So some people will say, well, you need to get an erection or screw this many times every day or every week. And that's not the case. Like people are different. Their rhythms are different. How much testosterone they produce is different. How turned on they are by certain things can be different. So it's literally about like what your norm is and if there's a difference from the baseline. So like for instance, and I used to see a lot of younger guys with erectile dysfunction in Philadelphia when I was practicing up there. And so some of the first questions I would ask, and one of the basic questions to ask when we start is, can you get a hard-on? Do you get erect when you wake up in the morning? Because during the nighttime, we get what's called, the medical term is called nocturnal tumescence. And so basically what we do is we get hard because the hormones are kind of fluctuating, the blood vessels are fluctuating, we're asleep, which from the nervous system perspective can actually lead us to getting hard. So when you wake up in the morning, it's actually physiologically normal to be hard. So if someone says to you, like, hey, I'm having trouble performing with my partner or with partners or when I have sex, and you say, well, do you get erections in the morning? And they say yes, then you know that the physiology, like the nerves, the blood vessels, all that stuff is kind of fine. Similarly, one of the questions that I'll ask will be about, can you masturbate? So I've had people come in and be like, okay, I had a girlfriend for a while and now we're just not having sex anymore. And I was like, well, do you jerk off? And they'll say, yeah, I jerk off every day. Or I can jerk off and I don't have a problem with erections then. And then you have to go into the dynamics of the relationship. Because obviously the shit is working.
Right.
The piping, the pipes are working. So you have to just figure out, is there something else that's actually going on?
Johnny, do you want to read Walter's question or do you want me to read it?
Sure, thank you. Walter, thank you so much for your question. Walter says, I'm a 37-year-old black male, HIV positive, 19 years, have end-stage renal failure and early-stage congestive heart failure. Those factors and meds affect my dick. Any suggestions? Thank you for that, Walter.
Yeah, so Walter, and that's part of the problem too. Like when you think about some of the medications, whether they be blood pressure medications or heart medications, some of them can actually, there's a class called beta blockers, which slow down how strong your heart beats, how fast it beats, and those kind of things can actually slow up erections and cause problems with erections. There's also things with, and we'll talk about this a little while when we talk about treatment, but like vasodilators that you use. So like medications to help drop the pressure by opening up the blood vessels, those can also cause some problems with it. Antidepressants can cause problems. So things like Paxil, Prozac, Celexa, those kind of medications, that class of medications can actually cause problems with erections as well. But it's not uncommon, Walter, that like if you have end-stage renal disease, if you're on dialysis, if you have heart failure. Because if you think about it again, the blood flow has to get down to your dick. So if you have heart failure and your heart isn't pumping as strong, it's not going to be able to get the blood flow down there like it needs to. So that's a great question. The thing is, you ask like, well, what can I do to treat it? So we're jumping ahead here, but it is there's a few different things. So the first things people talk about are, drugs like Viagra, Cialis, Levitra. There's another one, I'm blanking on the name of it. But those help to kind of open up the blood vessels so it eases the blood flow down to the penis. So when you do get aroused, your dick will get hard and it'll stay hard for a longer period of time. There's also penile pumps that people use to like suction the blood into the penis, where you have to kind of manually do it yourself. They also have penile injections where you actually have to inject, it's almost like an insulin injection into your penis to inject the medication that opens up the blood vessels. So that can work as well. And then I think also they have penile prostheses. Okay. Where you actually have something surgically implanted into your penis to keep it hard. And then finally, I think one of the treatments that I've read about in the past is they actually have injections that can go right into the tip of your dick, the urethra, and give some of the medication there. But again, once you start getting into those injections, you can have problems with like pain and different side effects locally at your penis. So it's just going to be a little bit difficult. But in a situation where you have chronic medical problems like that, the medications may not work, so some of those options may be your only options.
So what about some of those herbal remedies that you see at GNC, horny goat weed, all that type of stuff?
Yeah, so horny goat weed, I saw a show, and yohimbine is another one that actually works with hormones and blood vessels to open it up. Yohimbine I've read and heard a lot about that actually does work. And then the horny goat weed, I think one of those things, and you find like if you're driving, especially in the Southeast, if you're driving, you go to a truck stop or a gas station, they're all over there, like keeping people hard. They actually did. They had a story on the news the other day where they actually found that it had trace elements of the medications in Cialis, Viagra, those kind of things that were actually in there. So they had to pull them off the market because those are prescription drugs. Those are prescription medications. So you can't give those over the counter that someone could just stop to get gas and then pick them up. So there's a whole kind of thing. But those people that are trying to sell those are just trying to make money. So they don't care about the Food and Drug Administration, the FDA, if they approve it at all. They're just trying to make a buck. And then as soon as people latch on and say, hey, you guys are doing this illegally, they'll find and change the name and rebrand it, and they'll do all those kind of things.
I want to bring in this question from John because I think one of the things I think I've experienced this or seen it happen, but John's question is, can condom cause some not to be able to maintain erections?
Absolutely.
Part one of this question. And then erections are easier for me without them. Is it psychosomatic or performance anxiety?
No, I think it's both. It can be both. It doesn't have to be one or the other. So there's tons of guys, like everybody. I've had this problem. I think that a lot of people could say they have this problem as well. When you put a condom on, it kind of constricts the blood vessels.
Yep.
So you could get hard, and then once you put the condom on, if it's tight enough, it traps the blood vessel in your dick. But in other cases, because you can't feel the sensation, and the sensation have to do with the nerves, so when you're screwing or whatever it is you're doing, you can't get the sensation from the nerve endings on your penis with a condom on it. You're not going to be able to feel it. That can't go back to your brain to tell everything to kind of keep going, and so you lose the erection. It's a very, very common thing, but an important part that you mentioned in that is that it becomes very psychosomatic. And so what happens is that once you can't keep it up one time, it gets in your head. And I've seen tons of people where it's like, I can't fuck anymore. Like, I just can't do it. And once you get that embarrassment that first time, when you try to do it again, and so what I've done in situations like that is give people like a few samples of like Cialis or Viagra and then say, okay, and this is the way I'll term it. I'll say, go ahead and try these to try to get your mojo back. And then once you do it once and you actually function psychologically, it can give folks more confidence, and then they can perform from then on. So it's interesting because it's not an either or scenario, because the medical kind of mixes with the psychological and they can feed each other. So it becomes a self-fulfilling prophecy. So that's a great question.
So that was another one of my questions. So is that a placebo effect, meaning if you have that type of anxiety, which is causing you not to get erect, but you have a pill, what is working?
Well, I mean, everyone's going to be different, but like the pill does actually work physiologically, because
even if you have that anxiety,
absolutely,
it's
even
going to overpower that.
Oh yeah, it's in that no matter what, because the way the pills are working, the way these pills work, like Viagra, Cialis, Levitra, they work by inhibiting an enzyme that causes your blood vessels to open up. So they don't allow them to constrict. And it has a lot to do with nitrous oxide, which is also in poppers. So for those of you watching that like use poppers, and we were having a conversation about this before we got online, but like, people use poppers, and the way I was introduced in poppers back in the day, like I told you, was if someone was topping, they would sniff poppers like Rush or Jungle Juice, some of these other ones, to kind of open up their blood vessels so that their dick could stay hard. And it wasn't until later that I learned that bottoms use it.
Right. Bottoms use it.
Bottoms use it to kind of relax things.
Yeah.
So, the thing is that physiologically it is doing something.
Okay.
But to say that it's not interspersed with like some psychological stuff is probably being short-sighted. There's both in there.
We should probably go to Jarrell's.
Yeah. So we have a couple. Jarrell. Yeah. So we have a couple questions here from Jarrell. So we're gonna go there and make sure that if you're watching the video, I'm looking at the question and not looking at y'all.
Like.
Please make sure you hit the little thumbs up to like the video as well, and make sure that you go ahead and share it as well on your social media if you are joining us and are enjoying yourselves. So thank you all for joining. Jarrell wrote, at the age of 23, I was diagnosed with HIV. Up to the age of 23, I've always performed very well sexually. But since my diagnosis, I now have very low testosterone. My former urologist has recommended to me that I take testosterone shots or HCG shots. I'm going to ask you what that is in a second.
Yeah.
I'm not sure what that means. However, I don't always see a difference. Do you think HIV has any issues with this, and should I revisit a new urologist now that I live in Atlanta? Thank you so much, Drew.
Yeah, Joel, that's a good question. I think one of the misconceptions about testosterone is that is the end-all be-all of erections, and it's not. Testosterone actually, in most of the literature that you'll see, if it drops low, and normal values are between like 250 and maybe like 1100, something like that. If it drops low, your desire kind of drops down.
Got it.
But the good point that Jarrell brought up is with HIV, you can actually have a lowering of your testosterone that can influence and kind of cascade into problems with erectile dysfunction. In my history of practicing with HIV and seeing low testosterone, the only times I've seen people have really low testosterone is when they've allowed the HIV to progress and it's getting to AIDS, an AIDS definition, and their T cell counts are like single digits or double digits, and then HIV is kind of wasting away, and I see testosterone levels in the like 5, 10s, like double digit range, and it's really, really bad. And they're wasting, they don't have any muscle mass, they have no energy. And those are the symptoms that you have with like low testosterone, is that you don't have any energy, you're depressed, you have a depressed mood, you may not have a good appetite, you don't feel like having sex, like all these different things can happen. So what I would recommend, and especially most primary care providers can give stuff like Viagra, Cialis, Levitra, those kind of medications. But if you're having problems even with those, or if you have some other conditions, then I would recommend going to a urologist. I wouldn't underestimate also, Jarrell, and anyone there who's out there who's living with HIV, is the psychological impact that HIV can have. And also, when you're fearful of transmitting it to someone else, if you're fearful about disclosure, and how that plays with your psyche when you're about to have sex with somebody, and how that can kind of cause you to think about other things and get distracted with it, so you can't actually be in the moment and enjoy the sex. And that's why it's so tricky, because it's so complicated with all the things that can happen. So it becomes a real problem on several levels.
So this brings up just that very point. Like, one of the things that I recognized personally from personal experience is that my experiences with erectile dysfunction were due to things that were happening around me at the time, where I couldn't be in the moment. Because one of the things I just read as I was doing research for this show is erectile dysfunction is not necessarily a consequence of age, right? And in fact, I was talking to a friend of mine who, is in his mid-50s and has not experienced erectile dysfunction.
Right.
And it was just another reminder. And so thank you for just kind of bringing all that, because it could be a lot of different factors.
Yeah, and 2 points on that. I think you want to avoid generalizing. It's kind of like, I think erections are almost similar to like, you ask somebody, well, how many bowel movements do you have a day? Everyone's got different metabolism, right? So some people can say, I have a bowel movement 2 or 3 times a day. Other people may have it once every 3 days, but that's normal for them. So the question to ask yourself is, are you off what your normal is? And the other thing that I will mention, and some of you said reminded me of this, when I take a history with it, one of the things I do is I go into childhood history. So like one of the things we don't talk about, and especially with young adults, and it can even carry over when we're all getting older, is that your childhood teachings, like did you have a lot of religious teachings that told you that sex was bad, that masturbation was bad, that erections were bad? And then also, too, we think about we're a very porn addicted culture.
Very much so.
And so you think about it, too, what I've seen in my experience is guys who watch porn a lot, masturbate a lot. So there are 2 things that happens when you watch porn and you masturbate a lot. One, your dick gets used to your hand, right?
Yes.
So then when somebody else tries to do something with you, it's not going to be the sensation. Right. You'll be like, dude, you're not doing it right. Could you lick on the hair? Could you put your hand right there? Could you put your finger in there? Yeah. So to try to get the stimulation, because you know what you need to get off. Right. The other part of it, and I'm blanking because it was just so funny. I was just looking at it. But seriously, like you can have those things where physically you don't get it. And then also the pressure to perform like a porn star. Yeah. So if you look at porn, and especially back in the old days, I don't know if it's as common now, but like in a lot of the produced porn, like people used to come at the same time.
Absolutely.
Like with the gay porn. Like, yes. And of course they're cutting and they're editing. Right. But if you're a teenager or a young adult and you're sitting there watching this and you're like, oh shit, like everyone's supposed to come at the same time, that's what you think the norm is. So you think it's a failure if both people in the sex act
Yeah.
are not
Yes.
coming at
Yeah.
the same time. And so you think, okay, I have to do it like this. I have to perform up to the expectations of a porn star. And that can put pressure on us and therefore get in your head and cause you to not have a good erection.
And especially being black men, there's the pressure of being aggressive and
Right.
Yes.
beating it up
Right.
and all of this type of sexual behavior that your body might not even
Respond-
be
Right.
responding
Right.
or corresponding to.
Right,
But
right.
you feel like that's what sex is supposed to be and look
Right.
like or feel
Yeah.
like.
Yeah, and I think that's a good point because it's
Yeah.
also like how people see you.
Yeah.
And so what they want you to perform and what the stereotype based on how you look, how you're supposed to perform, and if you don't
Yeah.
meet that expectation,
Yeah.
and then if they act a certain way, you're going to feel some certain way after that, and it's going to be crazy. So I will tell this to people who are watching out there, don't underestimate the psychology behind erections because it's a huge, huge thing. Not only causing problems with your erections, but then also if you have medical conditions that are causing problems with your erections and then it fucks with your head, then you're going to really have problem moving forward after that.
I think one of the things that this brings up as well is that need to. So if an individual is possibly experiencing like a chronic condition, to try other things sexually that are still pleasurable.
Right.
And I have a question. So as you know, please comment if there are things that folks have tried where if you were experiencing trouble having an erection, where you tried something else and that was as pleasurable as something else you would have done. But that did bring that up.
Yeah, the other thing that I've heard people talk about before is that as we all get older, you expect that you're not going to be able to get as hard as much. Or erectile dysfunction can be defined as like you get hard, you come, but you can't get hard again as quickly as you did when you were like 19 or 18. And the thing is that there's going to be a drop-off. Like after 30, it's well documented there's a drop-off in erectile performance for all men as we get older. Couple things that people say about that. One is that lifting weights can help a lot, and that's why people say don't just do cardio, but actually lift weight because that actually can help boost testosterone naturally, and then that can kind of feed into this cycle, working with the hormones, working with your nerves and with your blood vessels. And then also, I've heard some people say that like doing squat or leg exercises,
Interesting.
and the reason why is that it increases the blood flow down there. So the more you working your lower body, like if you're one of those people that like balloons up and got all the top muscles and then your legs are like this, that could be a problem because if you're using your muscles, they demand more blood flow and more oxygen. So think of it that way. If you're doing squats, lunges, any kind of leg exercises, it's all going to be down in here. And so your body's going to demand more blood flow, more oxygen. And so naturally, you're going to think that it's going to come down there. So again, it's about like the physiology, about your nerves, your hormones, your blood vessels, all that kind of stuff.
And what about cock rings?
Oh.
Cock rings can do that too, can just keep it. And that all it does is trap the blood, right?
Right. Is there any harm in those? Because there's a lot of tight restricting of the vessels and all of that that's taking place.
Yeah, so there can be damage. You can burst blood vessels with that, and it can cause a little bleed right under the skin of the penis. And then also, like I've heard situations where people can't get them off. And then if you have, it's a condition called priapism, and they give it as a warning with the medications like Viagra, Cialis, Levitra, all those ones. And they say if you have a erection that lasts more than 4 hours, like you can actually do permanent damage to the spongy tissue and to the blood vessels in your penis. So with cock rings, just please be careful about that. And I mean, I know there's different ones, like there's metal, there's the
Rubber
rubber ones,
the
people like the
leather
ones
ones
with
with
the strap,
snaps.
with the snaps on.
Yes.
So I know a lot of people that like prefer the ones with the snaps because you can
Yeah,
just take
take
that
it
off if it becomes
Yeah.
too uncomfortable. That's a great question.
I am one of the things that, and we kind of touched on this as well throughout this, but I'm thinking like the performance anxiety piece. So when thinking about condom usage, right, which is, so, you know, there is the barrier can sometimes reduce some of the sensation.
Right.
And so it's that can also be a factor as well, and it affects erections, and then condoms fall off, and et cetera. So I just wanted to kind of explore that a little bit.
Like what it means for us on a larger scale.
Or for folks who are folks who just are interested in using condoms during sex, but also recognize that
There's a reason.
it may cause some erectile dysfunction.
Yeah, I even remember like when I was teaching a resident back in the day, at Grady Hospital, and I was asking him. He was like, "Well, Dr. Malebranche, what's the research that you're doing?" I was like, "Well, I do research, behavioral research around like why men, may not use condoms and this, that, and the other." And this was a cis, hetero white guy. And when I said that, he was like, "Well, duh, it doesn't feel as good." And I remember thinking, and it's just, and it's like the most simple thing, because we do all this stuff and we like to pathologize, especially black men today. Like they pathologize us to say, well, why aren't you guys using condoms, and why aren't this and this, that, and the other? And they don't talk about that in the general context that, sex is about pleasure.
Yes.
So you're trying to find pleasure, and putting a piece of plastic on your dick or rubber or polyurethane or latex, whatever the fuck it is not going to make the sex more pleasurable. It interrupts the moment, it interrupts the flow, and then the sensation on the tip of your dick. And, if somebody is uncircumcised, you think about, the foreskin that actually, rubs the head and kind of gives more sensation. And so you think about all these things kind of coming. It's no wonder that a lot of people have problems with erections in this country. Like, it's really something that's, and it's also a big booming industry when you think about it. Like, Viagra, Cialis, like that's billions of dollars a year for how much they charge.
Unfortunately, there are prevention options out there.
Yeah, right.
Not to be a prep evangelist,
Right, yes.
but there are prevention options
Yes.
that allow us to make decisions for ourselves
Yes.
about our pleasure and our protection.
Yeah,
Yes.
and I think that's a good point, because I think we don't talk about like pleasure with all this, and then we always focus on condoms. It's like, well, in today's day and time, we have PrEP.
Yes.
We have a pill that you can take every day. So if condoms cause you to have problems with your erections, you can still enjoy sex without condoms and still protect yourself. Obviously, it won't protect against some of the other STIs like we talk about, but for HIV, if you're really concerned about that, it could help. So,
Could you do another reminder about subscribing?
Mm-hmm. So thank you all so much for joining. I want to stop thinking I'm looking at y'all here. Y'all are doing. Thank y'all so much for joining us. Please make sure that you are hitting the like button. If you are here and have not subscribed, please go ahead and make sure that you hit the subscribe button that is on your screen. And make sure that you put any questions in the chat box as well.
Trey says thick thighs save lives.
Big thighs do save lives. Yes. I want to go back. There was something that Damian said about like expectations, and I think this is really important and specific with like black men and kind of what we go through. Like, everyone expects us to have big dicks, and everyone's gonna be a top, and everyone's gonna fuck the hell out of that pussy, whatever it is, and do all this other stuff. Charles is gasping over here because
he just fell out.
Because I keep cursing. But I think that's a big part of it as well, because if you get on Grindr or Jack, there are all these non-black and white guys. Give me that BBC, give me that big black cock. And so I don't think I've seen any studies that have actually like investigated like that culture and that context and how that impacts black men as far as performance anxiety, erectile dysfunction, stuff like that. Like, I've seen studies about
I've seen it about desire
and about the stereotypes.
And the stereotypes.
Yeah.
But not in relation to performance.
There
You're
was
right.
a race-play study at UC San Francisco, apparently.
A race-play study?
Yeah, and I remember there was a study out of San Francisco that Patrick Wilson did about, it was online chat rooms and just the stereotypes. So, of course, it was the typical stereotypes, like the black man was always the top with the biggest dick. The Latin brothers were, like, really, really, hot and passionate and this, that, and the other. The Asian guys were always bottoms with small dicks. And then it was the real fucked up thing about the whole thing, because they interviewed a whole bunch of different races and ethnicities, was that it was always like white men were kind of the reference point, the normative point. And so everything was kind of skewed one way or the other compared to that white norm. And so even when you look at these studies, they're kind of skewed in a racial fashion with that. But I think...
Ever say, give me that big POC cock?
Not big POC.
Charles asked if people say, give me that big POC cock. I've never heard, give me that big people of color cock. I don't think that's been exclaimed in any taco. Give me that cock of color. Right.
That doesn't sound hot.
I mean, you might be coining some stuff over here.
Right, exactly.
Something.
Charles, you may want to copyright that. Someone's going to steal that. But yeah, I think with erections, it's very, very common. And I think we can do a whole separate show. We were talking about this before, like doing a show to talk about like poppers.
Yes,
and how
we
they're
absolutely
used
should.
and for the medical use and stuff like that. And one of the things with poppers as well as like Viagra, Levitra, because they're all opening up the blood vessels, they lower the blood pressure. And so you'll hear in a lot of these commercials, like people say, if you're on nitrates, because you think about nitrous oxide helps to open up the blood vessels. Nitrates, the medications, which are used for heart conditions, like if you have heart attacks, it helps to open up and improve the blood flow to your heart. What can happen is if you're taking something like Viagra and you're taking these nitrates for your heart, it can really drop your blood pressure, cause you to pass out, ironically cause another heart attack because your blood pressure is so low, you're not getting enough oxygen to your heart, and do all kinds of problems. So they tell you if you have any heart conditions like that, or if you're on any other, what they call vasodilators, medications that open up your blood vessels, to just be very careful when you're using poppers or when you're using Viagra, Cialis, stuff like that.
And thank you so much for that, because I know that one of the things we didn't talk about on this show, but there is also recreational use of Viagra as well. That could be an entirely separate topic. But I think there's a couple of things that, as we wrap up, that came out. One, I do want to thank everybody for joining us and being very active in the chat room. But one of the things I think we do need to talk about at some point is we do need to talk about like black men and penis size too, because we do come in all different sizes, and I think so often society tells us that that's not true.
Right.
So a couple of things before we go. Make sure that if you haven't, go ahead and like the video. That means hit the little thumbs up sign that's on the screen. And make sure that you subscribe to the Counter Narrative page here on YouTube. Please make sure that you follow us on Instagram at The Counter Narrative, and on Facebook, you can like our page at Counter Narrative Project. You can also follow us on Twitter at Building Desire. Thank you so much for joining us for Revolutionary Health. We will be back next week, and we'll be talking, we'll have another conversation here. I just knew what the topic was, and I forgot. So
It's PrEP and stigma.
it is PrEP and
PrEP and
stigma next
stigma.
week.
Prep evangelist.
Yes. PrEP and stigma next week. Please join us. Thank you so much for being with us tonight, and have a good evening, everybody.
Bye, y'all.